Inflammatory markers, inflammation, your microbiome, and the gut barrier test. There is a way, and it is through your gut. In part 2 of episode 5 of the Health, Nutrition and I podcast, nationally acclaimed practicing clinical nutritionist Ishi Khosla engages in a conversation with Dr. Arjun Dang, CEO and partner of Dr. Dang's Lab, New Delhi, in the series Test, Don't Guess.
So when we get to the root cause, just by giving a statin or giving an antihypertensive, they are important. But when you get to the root cause of inflammation, then the whole thing changes to, first documenting the inflammation through your tests, and then where is the inflammation coming from, and then treating that as your starting point. So what do you think we should be doing with inflammation?
So again, when we talk about etiology of many of these metabolic disorders, and not only etiology, but also the end point why they occur, like you said, I think chronic low-grade inflammation is a particular parameter that doctors do use to not only predict the disease, but also monitor it over different time points. Now, when I talk about in vitro diagnostics and how we actually look at these inflammation markers and parameters, is because I think the entire medical fraternity and also the globe got a lesson about inflammatory markers, unfortunately, during the pandemic.
COVID, yes.
Yes, and at that point of time, even a lay person knew what a CRP was and what an interleukin-6 was and a D-dimer was. So I think I'll start from there so that our viewers can also relate more.
Everyone can relate.
But again, when we talk about something like an inflammatory marker that's very commonly accessible is CRP, that's C-reactive protein. And there are broadly two types of CRPs as well. There's one regular C-reactive protein and a high sensitivity C-reactive protein. These are basically acute phase reactants. That basically means that, for you to understand, these are chemical mediators that increase whenever there's any kind of inflammation in the body. So that inflammation can be a sprained ankle, it can be an injured back, it can be a strep throat, it can be like a normal viral or a flu that you've had. It can also be COVID, it can also be tuberculosis, it can also be some autoimmune disease. So any kind of inflammation in the body, even like a mild fever can cause your CRP to go up. But it's very important to actually look at this CRP. If you're looking at for systemic inflammation, the first advice is that you should do an HSCRP. So that's a high sensitivity CRP. It's more sensitive than the usual CRP at detecting lower values.
Is it only for cardiac?
No, that is used for everything, but also for cardiac. So, for example, the normal CRP ranges between 1 to 5. HSCRP ranges between 0.1 to 0.5. But HSCRP's values can also be directly correlated to cardiac risk. So if you fall in the ranges of 0.1 to 0.3 or 0.3 to 0.5 or more than 0.5, that's how literature shows that you can actually tell someone's cardiac risk or risk for any cardiac events in the future based on these ranges. But what you have to be very mindful about is that these tests, when you are ascertaining any kind of low-grade inflammation, are only useful if you effectively rule out any other causes of inflammation. Or in other words, the person should be in the pink of health. They shouldn't be like, oh, I went to the gym yesterday and my back is hurting a little bit. Or they shouldn't be saying that, oh, I had a little flu few days back and mild fever 5 days back. So do these tests when you're completely in the pink of health. You can't feel any symptoms or any inflammation, so that you get a true figure. And then, of course, you can monitor it over time also. So CRP is a common example that people would understand, but today we have a repertoire of these inflammatory tests such as cytokine panels. Now, interleukins are the most common cytokines, and traditionally people used to do an interleukin-6 most commonly, but of course we offer an entire host of interleukins now because every interleukin...
So should everybody do these? Interleukin-6 and the...
So like you said, if someone has a chronic disorder, if someone has a debilitating disease that is being very difficult to manage, then they can go into these nuanced interleukins and these cytokines. But I feel everyone, from a preventive perspective, if they want to look at any kind of cardiac risk, simple markers like HSCRP are very useful. Again, if someone has a severe infection, like it was COVID, you can do a D-dimer, you can do a fibrinogen, you can do an interleukin-6. But of course, these other markers like TNF alpha, like interleukin 1
When
beta,
should we do those?
so those are disease specific.
Those
Like for
everyone
certain
shouldn't.
liver conditions,
Huh.
doctors always ask for a TNF alpha. And I don't recommend that everyone should do these, but of course it's more targeted depending on what
So
inflammatory
liver
disease you're
disease, if
dealing
is
with.
or any digestive disease which is chronic, should be addressed with a marker like that.
So I would say for gut, for ascertaining gut disorder, there are a host of other tests.
We'll come to those, of course.
Great.
Yeah.
Health, Nutrition and I with Ishi Khosla. Produced with support from the Illness to Wellness Foundation.
Before COVID, even those who were really not well, not acutely ill, not infections, but they were just obese or they had comorbidities, never had elevations in CRPs the way we see it today. And even in patients who are following my diet and are on lifestyle changes, very adherent and compliant, sometimes we find really no reason for the CRP to be elevated, and we really have to do a deeper dive. But I think this post-COVID, post-pandemic picture is really changing. Before we move on to the microbiome, just tell us about the other markers.
Yes, so like you said, ferritin is a very important one. Ferritin actually traditionally was always used as a marker that tells you about the storage form of iron in your body. But ferritin, also being an acute phase reactant like C-reactive protein, is also seen to go up. I always feel that with these inflammatory markers, it's never an absolute value, especially when you're trying to monitor or track a particular progress of a disease. It's more of where it was and where it is now. So that's how doctors use it,
Like a
at the
baseline.
start of start of the illness, and then how the patient is doing. So again, ferritin is something
But
that
is it done as a part of iron studies routinely, or you have to ask for
absolutely,
it? Yeah?
absolutely. So it's done as a part of iron profile that has iron, TIBC, UIBC, transferrin saturation, and ferritin. Whereas when someone asks for just iron studies, it just includes the serum iron, TIBC, UIBC, and transferrin saturation. So again, I feel that a lot of people also come in when they have fever and then they get this iron test done, and suddenly their iron deficiency gets masked because their ferritin obviously will be elevated if they're running high fever. So yes, so there are also other inflammatory markers such as fibrinogen also that is used commonly even in the pandemic that we saw.
Why,
These are
why don't
fibrin.
we do it regularly?
So it is more when your coagulation cascade is being affected.
Not routinely, no?
That is when your D-dimers, your fibrin degradation products, your fibrinogen, all
So
of
these are
these
not in the routine panel,
yes,
right?
yes.
And I find higher B12 also an issue when people are not on B12 supplements as a marker of
Okay.
inflammation.
Is that also affected by if someone doesn't have sufficient water intake?
I mean,
Because it
those
is a
can-
water soluble vitamin, and I see people drinking very less water and
I think
not
we
on
should
any
rule
supplements.
out those before we read
Or
into
optimize
it.
their
Yes,
water
yes,
intake
of
at
course.
least.
I mean, that's what. First you do that and then check. So yeah, so basically CRP should be done for everybody. HSCRP should be done for everybody. And iron studies should be done for everybody. And vitamin B12, which are a part of nutritional parameters, and we should be doing them on a routine basis. And I still remember your father always saying that kuch test karao na karao, tum CBC zarur karao. Even if you are doing some other test, but do a CBC, because that information that you get in a CBC is quite valuable.
Health, Nutrition and I with Ishi Khosla. Produced with support from the Illness to Wellness Foundation.
So what if we have established that there is inflammation, or even if we don't establish inflammation, we know that this inflammation is coming from somewhere. Where does this inflammation start? And then tell us about the microbiome.
So something that I always believe in from a functional perspective is that you have 4 pillars in your life. And when these are not optimally balanced, and please correct me if I'm wrong, but I feel that diet, exercise, sleep, and stress. I mean, these 4 have to be in complete harmony so that the entire orchestra of your body is, of course, playing well.
Absolutely right. Yeah.
And I feel that any kind of inflammation or any kind of chronic low grade inflammation can start playing up when these keys to the piano of your body are not being played properly. And of course, these days we also see that there is a new kind of culprit, that's your screen time. And of course, that makes your sleep and stress go in circles as well. That also affects your diet. So, I mean, all of these now, where sciences, they talk a lot about the gut microbiome. And they also say that a majority of diseases now actually start from how your gut health is, or how the balance or the diversity of the good bacteria in your gut is. So, I mean, talking
So
about.
you're saying inflammation is starting in the gut.
So,
Yes.
in a lot of cases, in a
Yes.
lot
And then
of
it
cases,
reaches
we
different
see
parts
that.
of your
Yes,
body.
absolutely. So,
Yeah.
because they do say that food is medicine, and of course, I am a firm believer as well. There are numerous case studies that we see, like what you were saying, different strains of bacteria and their balance or abundance in your gut can lead to different diseases. So, I mean, earlier they used to just say that your gut brain axis. Now, there's so much work done that if you take all your microbes in the gut, put them in a box, and actually weigh it, it's as heavy as your brain. So, I mean, not only the microbiomes that are so important, but even the vagus nerve that connects your gut to your brain again, and the entire enteric nervous system, that is the brain inside your gut, is extremely critical. And also, when you look at different hormones that are produced in the gut, such as serotonin, again, are extremely critical to your overall well-being, your mood, your stress.
Oxytocin, dopamine,
Absolutely,
melatonin, we
absolutely.
have GABA. There's so many of these, which we always thought were part of our brain, are actually in your gut. So, coming back to this whole, toolbox, I think the biggest toolbox for us would start with, I mean, the biggest tool in our toolbox would be our food. Ultimately, they say what's on your plate will determine your gut health, your microbiome health, and therefore the orchestra, which
Yes.
the microbes play with our own cells and our genes. So, a lot of times people say, "ये तो genes में है," but at the end of the day, the gene is also being expressed or silenced by the metabolites of the food and the gut microbiome.
Health, Nutrition and I with Ishi Khosla. Produced with support from the Illness to Wellness Foundation.
So, when we get these tests, say we get the food intolerance IgG test, um, it's so overwhelming sometimes. That some 200-300 items are being checked. What, in your opinion, is that culprit which is primarily causing the leaky gut,
So,
and how do you document it through your gut
So
barrier
this is
test?
something that is very, very close to my heart, and also we actually, science and the entire fraternity actually stumbled upon this only a few years ago, and that's why I'm very proud to say that now we offer this particular test that looks at 4 parameters, and these are antibodies of these 4 parameters. The first one is zonulin, the second one is occludin, followed by LPS, that's lipopolysaccharide, and then candida. Now, while
I'll
most
repeat
of
that: zonulin, occludin,
LPS,
LPS, and candida.
Candida,
So these
yes,
are your gut barrier panel tests,
yes,
which tell you if your gut is leaky.
absolutely. So it has an IgA and a IgG component, and it checks for both antibodies for all these 4 markers that I've told you. And for you to understand, basically, the zonulin and occludin are basically markers that talk about the junctions in your gut. And of course, IgG conveys more of a long term kind of effect to it. That's a long term antibody, whereas IgA is more short term, or also known as a secretory antibody. And basis that, you can figure out if it needs attention. Basis that, you can also figure out if the interventions that you're doing for healing the gut, if you were at say 2 on 10 till about few months ago, are you really at 6 on 10 now, or are you still at the same level? So as your gut heals, your IgA antibodies for these various parameters should come down. Even LPS, that is something that's basically lipopolysaccharide, that's a toxin that's released from certain kind of bacteria. Even we see that come after people have been on over ingestion of antibiotics. Candida, again, like all of us know, is a common fungal organism, and of course, its growth and its footprint antibodies can also control how permeable
The
your gut
gut barrier is.
So, this is very interesting. And
Yes, and zonulin and occludin are also basically proteins which are secreted by the gut in, like, they control the tight junctions, but they are triggered by wheat protein, which is gluten.
Health, Nutrition and I with Ishi Khosla. Produced with support from the Illness to Wellness Foundation.
And that's it on part 2 of episode 5 of the Health, Nutrition and I podcast. We will be back with the concluding part of the Test Don't Guess series featuring Dr. Arjun Dang, CEO and partner of Dr. Dang's Lab, New Delhi. Check out our previous episodes with Dr. Neerja Hajela, Dr. Naveen Dang and Gulpanag on the Ishi Khosla YouTube channel. On the Health, Nutrition and I podcast, there is a way, and it's through your gut.
Health, Nutrition and I with Ishi Khosla. Produced with support from the Illness to Wellness Foundation.